We often treat patients who failed an IVF cycle in other IVF clinics. Now, lots of IVF cycles will fail, that's not a problem, but what really bothers me is the fact that they don't provide any medical details at all to these patients. So we have no idea of what the superovulation protocol was, how many follicles were grown, how many eggs were retrieved, how many embryos were formed, what the quality of the embryos was. It seems like they're deliberately hiding information from the patient and not sharing it. And I think that's completely unfair. Of course, one reason they do it is because they want to hold on to the patient. They want their patient to continue to coming back to them. They don't want their patient to go to some other IVF clinic. And by retaining all these medical records, they think that they will ensure that the patient doesn't leave them. But this is unethical and it's actually illegal because the medical records belong to the patient. But much more importantly, when IVF clinics do this, they end up causing all IVF doctors to get a bad reputation because the medical records are the property of the patient. And it's important that patients know that no matter what the outcome, patients can live with the fact that the cycle failed, at least if they know that the process was followed properly. And the only way they will know that is if they have details of the medical treatment, including photos of embryos. Good clinics do this proactively, routinely, without being told. And that's why patients need to be proactive because you can't depend on your doctor. If he refuses to give you the information, you're the loser. So patients should make sure that the clinic proactively and routinely gives information to all the patients who come to them, including photos of the embryos. This is the best way of making sure that you're taking treatment at a good clinic and you're maximizing your chance of getting pregnant.